announce a very exciting, important, and impactful investment, an important step forward as we continue to work to make Louisville a safer, stronger, and healthier city. Joined today by Councilman Ben Reno Weber, who's been a leading advocate for this initiative, who you'll hear from in a moment, Lieutenant Colonel Healy and other colleagues from LMPD, partners from 7 counties as well, all of whom are all working together to make this Crisis Call Diversion program, or a Deflection program, as some call it, an expanding reality. Because the top priority for me and all of us here in Louisville Metro government is to ensure that we have a safe city, to do everything we can to ensure that everyone is safe, feels safe, and gets the services they need in times of crisis. We're always looking to expand on what we do, to improve in what we do. And that's one thing that the Crisis Call Diversion program, or again, the Deflection program, as it's often called, actually does. It was started as a pilot program in partnership with 7 counties in 2022. And it's an alternative response model created by our city that allows social workers to respond to certain 911 calls rather than the police. That's because we want to send our police officers into situations where they have the best training and resources to provide the right kind of assistance. If a crime is being committed or has just been committed, we want to send our LMPD officers. But some situations really don't call for a response from law enforcement. Situations where someone might need a different kind of help, like a behavioral health professional, their services to help them through a crisis that they're dealing with. So when folks call 911, Metro Safe call takers ask a series of questions to identify appropriate situations, and then inappropriate situations transfer those calls to crisis triage workers within the Metro Safe Behavioral Health Hub. Those call takers who are well trained in dealing with this, they work to de-escalate the situation, to provide needed emotional support at that time, and create a safety plan and problem solve for the person who's in need, who's in crisis, that has just reached out to 911. People can now receive the direct care they need in crisis, and it allows our officers to focus on the work that they're best trained to do and that we want them to do, preventing violent crime and improving public safety. Deflection has already been an incredibly successful program for our city. So successful, in fact, that in March of 2023, we expanded the program from its initial divisions to all 8 LMPD divisions. And then, just a few months ago in January, we expanded the program's hours to have call takers from 10 a.m. to 2 a.m. And we saw the impact. Just this year, there have been nearly 11,000 mental health related calls that have come into 911. And of those, about 1,500 met the criteria for deflection. 1,500 calls. That's 12% of all mental health related calls across that time period. And as I said, the program currently operates between 10 a.m. and 2 a.m. 7 days a week in all 8 LMPD divisions. But based on the response from the community, based on what we want to provide to our community so people have access to the services and professionals they need at any time, I am so excited that today, in partnership and thanks to the support of Councilman Reno Weber, LMPD, 7 counties, and many other partners here within MetroSafe, we are announcing that we are expanding the Crisis Call Diversion program to 24 hours a day, 7 days a week in all 8 LMPD divisions. So now, 24/7, 365 days a year, when people are dealing with a mental health crisis and they call 911, there is going to be a behavioral health specialist that is there to help them when their call meets the criteria. That means more people across Louisville will be able to benefit from these services. That means our LMPD officers can stay focused on preventing violent crime from happening or responding to those dangerous situations. And our Metro Safe call takers will be able to more quickly answer the emergency calls that are coming in. We know that this expansion of the Crisis Call Diversion program is going to make a difference. We know that this deflection program will help get individuals in need the mental health services they need in real time. So now I'd like to introduce one of our great partners, Nicole Weissman. She's the unit manager for Deflection with 7 County Services, and she's going to tell us more about what 7 Counties is doing in partnership with the city. Nicole?
Good morning. At 7 County Services, we are honored to give the opportunity to expand our deflection program to serve more individuals experiencing a mental health or substance use crisis. One of our goals since the program began was to provide this service at any time of the day or night, and as of July 1st, we'll be able to do just that. We have a wonderfully diverse team of mental health professionals with a variety of both lived and professional experience. Our team can meet folks in crisis where they are, literally and figuratively, whether it's our crisis triage workers providing a listening ear over the phone, or our mobile crisis response team providing compassionate support in person, or a case manager connecting to the next supportive resource to hopefully prevent the next crisis from occurring. We have many success stories, but one I'll highlight shows how our program connects seamlessly with other programs within 7 County Services. An individual who was at wit's end called 988. He had been houseless for about a year, having lost his natural supports during COVID, and his substance use increased since then. After talking with a crisis counselor, he decided he was ready to make a change. The 988 counselor was able to warm transfer over to crisis triage workers at MetroSafe. They talked with him until the mobile crisis response team arrived, finding him in the park where he'd been staying. They took him to the hospital to be assessed medically, and once cleared, he was met by a peer from our addiction services, someone who had been in his shoes in the past. The peer was able to take him directly to services for substance use, and later he would be followed up with our homeless outreach team, who could help him get back to permanent housing. And this call initiated around 1 a.m., which further shows the need to expand our hours overnight. This story is one of many where our team has worked with our partners to meet someone in crisis, to walk alongside them and get them to their next step in recovery. At 7 County Services, we know recovery is possible, and we see it every day. We meet people, sometimes on their worst days, and walk alongside them on that path. We know that there's plenty more work to do, and we're just getting started. We look forward to seeing how our program will continue to grow over the coming months and years as we work alongside and strengthen our partnerships with others serving those experiencing a behavioral health crisis. Thank you.
Thanks, Nicole. Thank you so much, Nicole. Thanks to you and everyone at 7 Counties for the work you do in partnership with the Deflection program and all of the other important services that you provide to individuals in need across our city. You all provide great social services, great mental health professionals are part of the 7 Counties team. And so thank you all so much. Another great partner in all of this, our friends at LMPD. Again, we are doing this in part so that our LMPD officers can focus on what we want them doing most, which is preventing violent crime and responding to dangerous situations when needed. Here to talk a little bit more about LMPD's involvement in the Deflection program is Lieutenant Colonel Steve Healy.
Thank you, everyone, for coming. As we said in the very beginning, LMPD is truly excited to be a partner in this program. As some of the numbers that the mayor mentioned earlier, there's several aspects that help this entire community with this program. When you talk about the run volume that it takes away from LMPD, so our officers can respond to violent crime, actively patrol the neighborhoods. We've heard the complaints about, response times to accidents, taking reports and things like that. So that also helps do this. Our commitment is to public safety. And when we talk about public safety, we want everyone to feel safe, the entire community. And sometimes that means that we have a run that may come in, and we want to ensure that the best resources are dispatched to that call for service. And sometimes that response is not an individual with a badge and a gun. Sometimes that needs to be someone who's experienced in mental health, because mental health and mental health crisis is very real in our community. And that's something that we need to recognize, and provide the appropriate services to those individuals. So once again, LMPD is 100% on board with this program. We are very thankful to be a partner, and we keep coming to these press conferences and announcing how it's expanding and how it's successful. So I don't see that changing anytime soon. Thank you.
Thank you so much. And finally, I'd like to introduce a great partner, and not just because he's on Metro Council and helps ensure that we have the needed funding for this deflection program, but Councilman Ben Reno Weber is also a great thought partner in this. He is an advocate for providing more mental health services, whether it's through deflection or other avenues throughout our community. He constantly is pushing for our administration to do more. We appreciate the partnership. We appreciate his ideas. We are working to get all of this and more reimbursed by Medicaid, and he will continue to be a strong partner of ours with this program and many others that are working to support our community and keep our community safe. Ladies and gentlemen, Councilman Ben Reno Weber.
Thank you. Well, I really want to express the gratitude of Metro Council, many of my colleagues, for the people who are actually implementing this work, and for this administration for really pushing a public health approach to some of our city's most pressing issues. We know that when we center the most vulnerable in how we engage, we get much better results from a moral perspective, from a human perspective. And this program is one of several where we also get much better results from a financial perspective. And those are the sorts of investments that we are so grateful that this administration continues to make and expand. When we really invest in these communities and in the people who are in need, we then don't have to pay that price in other parts of our community. We don't have to pay that at the jail. We don't have to pay that in our ERs. So this is exactly the kind of program that we are glad to see that we are piloting, testing, and when we see that it works, we're expanding. And I'm just grateful to be able to leverage some of the bully pulpit that we have as Metro Council people and also our budget powers to really invest in this. So thank you so much for your partnership. Glad to be a part of it and excited to see this program continue to grow.
Thank you so much, Councilman Reno Weber. Again, this expansion begins on July 1st. So just in a few days is when the 24/7 time frame begins for the deflection program. We will continue to work with our partners at 7 counties, at LMPD and Metro Council, to continue to find ways to improve this program. And as Councilman Reno Weber said, look for other ways that we continue to serve the community to support with the behavioral health needs of our community, an issue that is growing in our community that we need to continue to support. So we thank you all for joining us. We're so very excited about this expanded announcement. And with that, we're happy to take any questions that you all might have.
Question for Nicole or Colonel Healy. These 1,000 or so calls that have been diverted so far, are they happening at a certain time of the day or time of the week? And are they coming from any particular divisions?
We can get all those breakdowns for you. We'll get that information out to you. I think you have to look at sometimes when your hours are, I guess, compartmentalized, now we're expanding them. So once we expand them to 24/7, I think then you'll get a much better feel of and measurables, because you'll have everything, as opposed to you just have limited. And then, calls that we may take now past those hours may have qualified for deflection, but now that we have the expansion, I think we'll have a better answer for you once we see this expansion.
And up until now, have you been?
I can speak a little to that. The expansion has been informed by data from the beginning. Before we even started the program, we looked at which divisions had the highest number of calls that were CIT, as well as what time of day. So that's why we initially started with the 4th division, and then 2 p.m. to 10 p.m. and have since expanded out from there.
And have you been able to measure, Colonel, the amount of man, the amount of hours or service time has been saved from the calls so far that have been diverted for officers or corporate?
I don't know specific numbers right now, but we can get that to you. We also had the University of Louisville that did a study alongside the initial pilot. So they have some of those numbers about what kind of police time was saved by the response.
Has it saved time for you guys?
Oh, of course it has. Of course, when you just look at the numbers, the runs that were moved to deflection, I mean, those are runs that our officers are not making. And who knows how long that run could have taken? Who knows how long deflection was on scene at that? That frees our officers up to take other runs for service. Because like I said earlier, we've heard the complaints about response times for other things, whether it be accidents, reports, and things like that. So 100% it has.
I know this program started in rural metro pieces for division because that's where they were generating those calls. Do you have an update on if that's still the case?
Could you repeat the question? I'm sorry.
Yeah, so I know that this program started in rural metro police's fourth division because that area tended to generate most of mental health calls. I was just curious if that is still the case, if that area is still seeing most mental health calls.
I don't have the exact data on that one, but it seems that for the most part, that the day that we initially had pretty well followed that. We can certainly get you that.
I think we're getting information that's in the first division is where the most calls are coming from, but we can get all that information. I think Jess can follow up and get that information to everyone in the media with where they're coming from.
What's the staffing issue or goal? Have you added staff to beginning July 1st or how's that going?
Oh, you got it right there. Perfect.
Just got handed some numbers. Thank you very much. So for the divisions for the month of May, it was Division 1 was actually our highest, directly followed below Division 4. So those were always the ones that were of highest. So we can certainly give you those breakdowns. And in terms of staffing, yes, we've been able to hire additional staffing specific to those overnight hours.
I still would need more staff in that area for the new timeframe.
We will probably continually be hiring, but we're in a pretty decent place right now, which is really nice to say. So we're always looking.
Which is how many people taking this role?
So at this point, we have 47 staff, and those are a variety of full-time, part-time, as well as PRN staff. And it's roughly about 34 full-time equivalent.
And they're mental health professionals who are.
Sure. They are a variety of folks that have a variety of experience. So we have folks that have worked a number of years in the field. We also have folks with lived experience with a peer support credential. So there are a variety of folks that make up the team. Whenever the team goes out and responds to them, there is a team of 2 to 3 folks with that blended experience so that they can really address whatever it is, that situation that is in front of them. Sometimes from that lived experience, sometimes from that many years in mental health professional service, just a variety, sometimes bachelor's level, master's on that.
And are these people in a position where they can bounce something back to the police, say, hey, this is not for us, this is for you?
Absolutely. That was one of the big reasons why we wanted to be co-located for this program, where we have our crisis triage workers actually in MetroSafe. So that really helps with that communication if something does change, where we may need a police or EMS response.
So that staff is all housed here.
The crisis triage workers are here at MetroSafe. Our mobile crisis response team is at another 7 counties location that they hub out of.
So once people are interviewing with new people, where do they go from here? Are they signed up for a program at 7 counties or what's the action?
Yeah, sure. It's a variety of what happens after the intervention. The biggest thing is we're meeting folks where they are and trying to de-escalate that crisis. So for many folks, it may be that they are just simply talking to our crisis triage workers over the phone. They just needed a listening ear. For some, they may need to actually go somewhere. With us having a variety of resources within 7 counties, as well as those throughout the community, we're able to say, hey, these are some options for you for what happens after this moment. We want to meet you where you are right now and get you through this moment, but also make sure you get that next step, whether that they do actually need to go to the hospital, whether they need to get connected with some form of treatment, whether that's outpatient or inpatient. We even work with folks regarding finding their natural support system so that they have more supports around them to help them in their walk through recovery.
Is there a most common course of action for your team? Is it just being in an ear or somebody in a medical facility? What's the most common thing you charge?
That is a great question because I feel like every day and every situation is very different. It is very broad. For many, it is that listening ear. For many, it is someone just talking to them in person. Some, it is going to a facility. So it varies very broadly.
Thank you all very much. Thanks. Oh, okay.